Yes, hello everybody, it's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl, and this time I get to spend with you guys and answer all your urine and burn-in plastic surgery questions and go over plastic surgery topics, and you know it's coming from a good source because I am a Ivy League educated, Duke trained, double board certified plastic surgeon. And I'm not that young. I've been doing this for years. That's right. So I've been doing this for 13 years now. Wow, time flies when you're having fun. All right. So today, what are we going to talk about today? So today we are going to talk about a subject that I've done. I've talked about it before. I've talked about it in the past, but it's been a while. It's been a long time. So I think it's time to bring it back because this is something that we go through every single day. Every single day with our patients, we talk about this, okay? And it's essentially what you're going to experience both physically and emotionally after surgery, all right? We like to call that the physical and emotional roller coaster, okay? And this is a very, very real phenomenon, okay? So this is not like just something that's made up or something that some people go through. Pretty much almost everyone that has aesthetic or cosmetic surgery will go through this to some degree, right? Some may have more swings than others, but everyone's going to go through this, okay? And it's not too much unlike other things that people go through, that women go through. For example, how you feel after giving birth, okay? Sometimes you can go through something like this as well. So it's a very common phenomenon after surgery. And so the way that we like to describe it is the physical and emotional roller coaster. En español sería la montaña rusa física y emocional. Me imagino que sí. ¿Okay? La montaña rusa y física y emocional. O montaña suiza, depende de donde tú eres. Okay? Pero, here we go. So, what do I mean by this and what is going to happen? Like, everyone should really pay attention. Those of you that are about to have surgery or maybe you just had surgery, pay attention to this, okay? Because it's really important. Because knowledge is power, right? If you don't know what's going on, that's when you have a lot of worry, a lot of anxiety, and it makes these things a lot worse because you don't know what is happening, right? And then you start to wonder, is it just me? Or, does this happen to everybody, or is it just me? And then maybe, perhaps you don't have a community to do here at Pure. So at Pure Plastic Surgery, we have a beautiful community. It's in our Facebook group. It's actually called Dr. Alex Earl, Earl's Pros Community. And if you want to check that out, you should definitely go there, okay? So it's one of our groups on Facebook. But that is where everyone comes together. Of course, myself, but then all patients that have gone through this already, and they help each other out, and they keep a nice, positive attitude, and it's truly a great community. I think it's actually the best plastic surgery Facebook group out there. There's no better, more positive, more informative group than that. So you should really check that out, okay? Here we go. So we're going to draw a graph here, and what we have on this axis is time, all right? So starting with day 0, which is surgery day, because that's how we count it. When we say post-op day 1, it means the day after surgery. Post-op 5, it means 5 days after surgery, okay? And then so we have day 0, which is surgery day. Then we have 6 weeks, and then we have 3 months. And that's the time that this whole emotional roller coaster lasts, okay? And on this side, we're gonna talk about volume because I talk about this a lot regarding specifically the BBL procedure, okay? But volume and emotion. I didn't want to do 2 graphs because they both, they pretty much mirror each other. Volume and emotion, okay? So let's talk about the emotional part first, okay? Because this is the one that really pertains to all surgeries. And like I said, maybe to more or less degrees, but you are going to go through this, okay? So let's talk about the emotional part, which is why then I put this line here. And what this line means is that below this line, you are sad, okay? And above the line, you are happy, okay? So below the line, you're sad. Above the line, you're happy. So what happens, right? Okay, so before surgery, everyone's like super excited. Yeah, they're a bit nervous, a little bit anxious, but also a lot of excitement, right? And by the time you get here, which is pre-op day, the day before surgery, everyone is like, yeah, I made it. I went through all my pre-op stuff. I did all my labs. I got everything done. I'm cleared for surgery. And tomorrow is going to be the big day, and everything is like really, really exciting. But there's also, that's when the nerves kick in, right? Because now, hey, it's getting real. And so then those other thoughts start to creep in, like, oh, is this safe? Am I gonna get back to my loved ones? Am I gonna get back to my husband, my wife, my kids, my family, right? So there, some of those thoughts start to creep in as well. So you have the excitement, but you also have that anxiety. And that's one of the things that we really try to do here at Pure, is to try to make sure that you're as comfortable as possible, which is why we provide so much education for our patients, and why we do these lives, so that you get to know us and our team as well, so you feel comfortable, and also why, of course, we place your safety as our number one priority, right? And that's what we're known for here in South Florida, and really throughout the U.S. We're like the number one safest clinic in South Florida, and that's our reputation, because that is our number one priority, okay? But you go to surgery, so now it's surgery day. Okay, surgery day, people are pretty nervous usually, and so I see them, I talk to them, I do all the markings. Most patients typically kind of quiet, because they're maybe a little bit scared, a little bit anxious. We're about to start surgery, and then you get to the OR, and you're laying on the OR table, and you have about 10 seconds before you fall asleep. And anybody want to guess what is the number one most common thing that patients tell me before they fall asleep? Anyone want to guess?
Let's give them a few seconds.
Maybe a few seconds to guess there. Okay. While you do that, I'm going to tell you what is not the most common thing. So the not the most common thing is like, Dr. Earl, like, give me the perfect booty, or give me a vixen look, right? And all these other things, right? The number one thing, yeah, we got our answer.
One.
Yeah, sure.
I cried before.
Cry. Yeah, sometimes we do see tears. But the number one thing that people say are, Dr. Earl, get me home safely. Get me back to my ones. Get me back to my kids. Okay? That is the number one thing, because that is what pops in your mind as you're about to go under, okay, in this kind of, a little bit scary moment that we all try to make you as comfortable as possible. Okay? And so then you have surgery, and then of course, you're in recovery, and boom, it's like an elation, like everyone's ecstatic, like, yes, I had my surgery and I'm alive and I'm doing well, right? So you go through that kind of that euphoria at the beginning, where you're like really, really happy, and this is gonna last for like say a week or so, because you're just so happy that it's done, and that you're alive, you're getting home to your loved ones, and everything went great, just like we talked about, okay? But then you leave Pure, you leave our lovely team here. Sometimes we wish we could take a team with you, right? A lot of patients say that, like, hey, I wish I could take Jessica, our massage therapist, with me, or I wish I could take Ashley or Janet or Sarah with me, right? Because really, that's what our team is about, right? It's kind of bringing comfort to our patients. But unfortunately, we can't do that, right? I need here, and so you get home. And guess what? You can't really go out, right? You can't do things. You can't even drive sometimes, depending on the procedure. You're kind of like stuck in the house, not feeling great, all swollen, full of bruising. All this stuff is going on, right? Maybe some degree of pain. And so then you start to like get, emotional starts to go down. And then not only that, what's the next thing patients love to do? Even though I tell them, you're not going to see final results till at least 3 months out, 3 to 6 months, they start to do.
Take pictures.
Take pictures, or
the mirror.
Mirror. Yes, the dear mirror, right? You start nitpicking in the mirror. So you go to the mirror because you have nothing else to do. You're at the house all day, and you go to the mirror and you start nitpicking. You start looking at this little thing and that little thing, right? And we're like, and then you call us and you text us and we tell you like, hey, we understand, but there's a lot of swelling, there's a lot of bruising, implants, for example, need to settle. All these things need to happen, and it's going to take time, and you need to be a patient, right? Why do you think they call it patient, right? You need to be a patient, okay? But it still messes, with your head. And so you start to, do the nitpicking, you start to, be upset that you can't do all the things you were doing before, and things are still not looking that great. And so then you get to the low point. Low point is typically around 6 weeks. 6 weeks, usually most patients, it's the lowest point as you get into the 6 weeks. And why is it the lowest point? Because, well, you've been doing this for a long time. 6 weeks at that point in time seems like forever. You've been nitpicking at stuff forever. And you're starting to kind of get a little bit depressed, a little bit negative, right? And you start to get sad because you kind of you don't see the light at the end of the tunnel, okay? And unfortunately, sometimes at 6 weeks, we have had some patients that take it too far. Not only do they get sad and a little bit depressed and whatnot, but they start to get mad, right? They start to get angry. They start to lash out. And they lash out like at me, as a surgeon. Sometimes they lash out at our staff. I mean, that's really unfortunate. We don't want to see that, right? As much as we care for our patients and we want to comfort them, we don't want people lashing out and disrespecting us, right? It's a mutual respect thing there. So we don't really appreciate that. So that's why we want to explain, what's happening so that we don't get like that mad patient that lashes out, okay? Because now after 6 weeks, good stuff starts to happen. After 6 weeks is when you can start getting back into your life, into your routines, right? That's when you can start going to the gym. You can start working out. If you love swimming, that's when you can start swimming again. Certainly driving is before that, for a BBL, maybe by 2 weeks, for a tummy tuck or mind makeover, certainly by week 3 or 4, but still, more comfortable driving. If you did a BBL, guess what? No longer having to sleep on the belly and no longer having to use the BBL pillow, right? You can start sitting normally at 6 weeks. You can start laying down however you want. You're not uncomfortable. You're not like this all the time, right? You're not getting more headaches because of the neck position or how you have to sleep on your belly and all these things, right? And so then things start to get better, okay? And so things start to get better. You start to get out there. You get active. You start trying on new clothes, checking yourself out, seeing how that clothes is fitting now. A lot of the swelling and bruising, the bruising should be gone actually. The swelling not completely gone, but it continues to come down. For our lipo and BBL patients, that waist continues to shrink. And then guess what else happens at 6 weeks? You start to get into what we call the fluff phase, okay? So I was saying that this is not just emotion, but it's also volume. So when you first come out of a BBL, you're gonna have a lot of volume because you have all the swelling and all the fat, right? But then the swelling starts to come down and we are gonna lose some fat. So, no matter how well you do in your postoperative, we always lose some fat, and we typically lose somewhere around, on average, 30%. So you start to lose the fat, lose the volume. And so here it's a low point because the booty and the hips look small, but the waist still is not as small as it be. Then what happens? Well, then you get into the fluff phase. That's when the waist continues to shrink, the skin finally decides to soften up and fluff out, right? And so then the hips now kind of round out and fluff out, the buttock rounds out and fluffs out, okay? And you hit that fluff phase, and now things are really starting to look good, and now you're trying on new clothes, and you're getting excited again, right? You're going back into that happy place, all right? And then eventually, things will start to level off, and they'll level off somewhere around 3 months. You're not going to see your final result until at least 3 months post-op. But it could take longer. That's why I say this is not cookie cutter, right? The swings are different for patients. How long it actually takes can be different for a patient. For some patients, it might be 3 months. For some patients, it might be 6 months. Every patient is different, okay? But eventually, you're going to get there, okay? What I've never seen a final result before 3 months. You're not going to see that, okay? So what are the takeaways? So make sure that you know about this. Make sure about the emotions you're going to go through. And please know for sure that your final results are not 6 weeks. You're not going to see final results at 6 weeks. It's actually a low point. It's one of the low points there is on the graph, okay? So let me say that again. You are not going to see your final results at 6 weeks. It's actually a low point. Things are going to get better from there. Okay? All right. And then, of course, things level off and, You know how you can make this go up even a little higher? What do I always say is the best combination? You know? Willie knows.
Yes.
Willie knows. The best combination I always say is all three, right? Surgery, nutrition, and exercise.
Yes.
That's right. So now if you keep up that nutrition and exercise regimen, you're just going to continue to get better and better. All right? Better and better. Okay, so that is the physical and emotional roller coaster. It's very, very important that you understand this. Pretty much everyone goes through this to some degree or another. Maybe your swings aren't as high, maybe your swings are even worse. But that's just the way it is. Okay? All right. Happy to answer any questions.
Okay, we have a lot of questions today.
Good.
So, could you please talk about length of stay on out-of-state patient?
Yeah, certainly. So the length of stay is going to be, you got to be here up until what we call post-op day number 5. Okay? So that is the minimum stays. You got to be here for 5 days after surgery. So what's the total stay? The total stay is typically a week because you come in for for pre-op, which is the day before surgery, and then you have surgery day. You got to be here for 5 days after surgery. Okay, but for most patients, then you can go home at that point in time. The only patients that I say have to be here any longer are those that have really, really long trips, and we've received these patients coming from Australia, from Hawaii sometimes, from Europe, things like that. Patients that have, 12 plus hours to get back home.
Okay, would you work with someone that had a PE, pulmonary embolism, prior?
Unfortunately, no. So that is one of the things, one of the criteria that we have that would make someone not a candidate. So any blood clots, any history of blood clots, okay? So no patients that have had a PE or pulmonary embolism, and no patients that have had a DVT or a deep vein thrombosis, which is a clot in the leg area. Also no patients that have a tendency to clot, those that have, for example, like factor V Leiden. So people that have hypercoagulable disorders are also not a candidate.
I need to lose 30 pounds. Should I get a gastric sleeve first, then go to you?
Definitely. So let me say, definitely lose the weight before you come to us. How you lose the weight, that's up to you. There are multiple ways of doing that nowadays. There's gastric sleeve, of course. There's also the potential of using, the GLP-1 agonists, such as Ozempic or Mounjaro, and medications as well. So, but that's kind of not my decision. I'll leave that up to you, how you want to lose the weight. But yes, you should definitely lose the weight and get down to your goal weight and be at a kind of a stable place around your goal weight before you then, choose to undergo plastic surgery.
Okay, this is a patient from Canada.
Canada. Yes.
Is there an insurance we can get in case we need medical intervention?
Yeah, and we actually offer that for all our patients. In fact, for those of you that are watching right now, you should know that we are pretty much the only clinic in South Florida that basically provides this for every single patient. All of our patients here at Pure Plastic Surgery receive an insurance called CosmetiSure, which will help you financially if you happen to need to ER or need any medical intervention or end up in the hospital for whatever reason. And we provide this for you, for all of our patients, okay? And so the good news is that yes, it does work for our patients for Canada as well. So yes, all our Canadian patients get this benefit also.
Should one stop my anti-anxiety medicines before surgery?
So you don't necessarily have to, depending on the medication, okay? So if you're taking, say, the benzodiazepines, such as like Ativan, Xanax, those types of medications, typically you don't have to stop those before surgery. Of course, you have to let us know, and you have to let your anesthetist know, but usually it's okay to take those before surgery or general anesthesia.
Okay. This is a patient that said, I'm currently 6 weeks post-op, and sad face.
Oh no, you're right here. All right, so the good news is things are better, right? But you just have to hang in there, right? Not only hang in there, but you have to make sure that you continue to follow the post-op care regimen that we send you, right? That is the most important thing. You can't quit at 6 weeks because you're sad. You can't stop doing the things that need to be done to make sure that you have the best results.
Yay, my favorite doctor. I miss you and I'm coming back soon. Ellie.
All right. Yes, yes. Ellie, I look forward to seeing you again.
En español, porque también hablamos español.
Seguro, claro.
¿Qué tan peligroso es el BBL, un BBL, y si se puede hacer con lipo 360?
Seguro. Bueno, número uno, el BBL siempre incluye la liposcultura 360. ¿Ok? So esa parte ya viene incluida, es parte del paquete del BBL. ¿Ok? ¿Qué tan seguro es? Eso depende a quién tú vas a ir y a dónde vas a ir. ¿Ok? Porque es una cirugía que puede ser muy segura si vas al cirujano adecuado en el lugar adecuado. ¿Ok? Y puede ser una cirugía que puede ser muy peligrosa si vas a un cirujano que no sabe lo que es, que no tiene mucha experiencia, que no usa ultrasonido o que lo hace en un lugar que no es seguro. ¿Ok? Porque eso es muy importante hacer el research, ¿cómo se dice?
La investigación.
La investigación, a dónde es que vas a ir y cuál es el cirujano que vas a escoger para tu BBL. Por ejemplo, acá en Pure, ¿ok? Todo nuestro BBL, 100% del BBL lo hacemos con el uso del ultrasonido. El ultrasonido nos da unas imágenes para nosotros poder ver exactamente dónde está la grasa y para asegurarnos que estamos poniendo esa grasa en el lugar seguro, ¿ok? Que es entre la piel y el músculo. Donde uno nunca quiere estar cuando está infiltrando la grasa es adentro o por debajo del músculo. Y por eso es que no quieres ir a un cirujano que o no tiene la experiencia para saber eso o que no tiene ultrasonido para ver exactamente dónde está poniendo la grasa. Porque ahí es donde pueden haber esos fallos. Y si la grasa se mete dentro o debajo del músculo, hay un potencial de que la paciente pueda fallecer. ¿Ok? So, una larga respuesta, pero lo más importante es que tienes que ir a un cirujano que tiene mucha experiencia. He hecho 2000 BBLs, nunca he tenido un problema y hago 100% mis BBLs con el uso del ultrasonido para ver esas imágenes y asegurarme dónde estoy poniendo la grasa.
Okay, can a BBL be combined with tummy tuck and a breast lift?
So, this is a very common question. I think we get it almost every live.
Many times.
Yeah, and so the answer is I do not recommend that. Okay? Are there people that do it? Sure, there's people that do it. There's people that do it in other countries like the Dominican Republic, maybe Colombia, other places, and maybe even people here that do it in Florida. But I do not recommend that, okay? If you're in Florida, honestly, legally, you should not be doing that, okay? Because we are given rules by the Department of Health. And the Department of Health says that when you do a procedure such as a tummy tuck or a breast lift, mommy makeover, you are then limited to only removing 1,000 cc's of fat via liposuction. Okay, and that you should not be removing more than that. And so 1,000 cc's of liposuction is probably enough just to do like the flanks and the waist. You certainly can't do a 360 lipo for most patients. And then with only 1,000 cc's, that means you only have 500 cc's to then place on each side for the BBL, which is typically not enough to create the results that you want. Okay, so it's not really legal to do so in Florida. You're going to compromise your results. You're not going to get the BBL you want. You're probably not going to get the projection or the hips that you want. And the recovery is very, very difficult, right? Because for a BBL, you're not supposed to be on your back and your buttocks. For the tummy tuck, you certainly can't on your belly. So you're going to compromise one of the results, and you're probably going to compromise the BBL, right? Because you have to be, with the tummy tuck, you have to be face up. And so that means you're going to be putting some degree of pressure to your hips and your buttock, which is going to compromise your result. And last, but certainly not least, actually probably the most important thing, is that complication rates go way up, okay? So the risk of bleeding and needing a blood transfusion goes up. The risk of infection goes up. And importantly, the risk of blood clots to the legs or the lungs goes up significantly. And these things can land you in the hospital or worse, okay? So I do not recommend combining all those procedures.
So can you add on labiaplasty with lipo and BBL?
That's a good question, and quite honestly, I don't do labiaplasty myself. So Dr. Vidal is a surgeon here at Pure that does the labiaplasty procedure, and so I would have to ask her if she's willing to do it at time of lipo 360 or BBL. I think, potentially it's possible, but there might be a lot of swelling, that can kind of interfere with those types of results.
Okay. What's your BMI limit and how soon can I do a round 2 BBL?
Yes, so my BMI limit, my max BMI for BBL is 30. Okay. And when can you do a round 2 BBL? You gotta wait at least 9 months minimum. Preferably a year, but certainly no sooner than 9. So if you have BBL number 1, you gotta wait at least 9 months before BBL number 2.
Do you do in-person consultation?
Yeah, definitely. So we have actually 3 ways that we can do a consultation here at Pure. So the first one is what we call a virtual consultation, and that you do through our website. So you go to www.pureplasticsurgery.com. You're gonna hit a button there that says start your journey or virtual consultation. That's gonna take you to a questionnaire that you fill out, a way to also send us photos. And that's the easiest, fastest, most efficient way to get started, okay? And that costs $0, okay? Way number 2 is a video consult with your surgeon, okay? So after you kind of get in touch with us, one of our patient care coordinators will reach out, they'll of course give you some information, and then if you want to set up that video consult, they'll be happy to do so. And that's, that works well for people that want to talk directly to the surgeon and that are out of state, right? So you're from different states, different countries. And then the last way to have a consultation, or the third way I should say, is an in-house, in-person consultation. So that is also available. Once again, if you want to get started through the website, through the virtual consult, are the best way to do it, because then the patient care coordinator will reach out to you and then they can answer all of your questions and then go ahead and set up your in-person consultation. But always call us as well. You can call 305-230-4326 and set up start to set up a consult that way.
I have 2 more questions now.
Yes.
How long
Only
should...
2 more?
Yes, because we're on time. But how long should someone be of weight loss shots before the surgery?
Great question, because these weight loss shots are becoming more and more popular. Actually, they're very popular right now. And what are we talking about? We're talking about shots that are like, Ozempic, Mounjaro, semaglutide. And so these shots work really, really well. They've been revolutionary, really. I don't know if you guys know, but last year was the first year in a long, long time where the incidence of obesity came down in the US, and it's because of these shots. So they're very popular, and the problem is that once you lose all the weight you're gonna end up with loose skin. And the only way to get rid of loose skin is essentially to remove it, and that's where plastic surgery comes in. And so for us, you're gonna have to be off the weight loss shot for at least, ideally 4 weeks. So 30 days. 30 days surgery, you're gonna come off the shots, okay?
And this is a comment. So the more I hear you share your knowledge, the more I understand that if one wants a procedure, they must go to an expert.
That's right. That is exactly right. And we've done, I've also done a few lives regarding that specific subject. If you want to, learn more, please go to our YouTube channel, okay? Go to Pure Surgery on YouTube, and you're gonna see a lot of lives like the ones we've done here today. You're gonna see all our historical lives. There's a ton of information there. And I've probably answered pretty much almost any question you can come up with in those lives there. So I really, really highly recommend you go there if you want to learn more and really kind of become an expert yourself in all these procedures and like what to do before, during, and after. All right. Okay. Well, I guess that means time's up. Okay, well, I hope everyone was able to understand this. It's an extremely important subject. We talk about it every single day. All of our patients go through this, and it's better to know beforehand, so you know exactly what to expect, and that brings down jitters, brings down the anxiety, and you feel more comfortable, and you know that you're not the only one, right? Everyone goes through this. Okay. All right. But I look forward to seeing you all next week. If you have something that you want me to talk about, let us know, okay? Write me a DM, let us know. I'll be happy to dedicate a live to that. I just want to make sure that I answer everything that you want, okay? All right, everybody? All right, well, I look forward to seeing you next week on Hump Day with Dr. Alex Earl. I'll see you then. Take care.